So the Athens Area Community Foundation is a public grant-making foundation. We realized a lot of the issues we were funding as an organization, like homelessness, substance use disorders, all those things can be traced back to traumatic experiences or adverse experiences like a lack of food or instability in the home or violence or abuse. So one of our ultimate goals with the Resilient Northeast Georgia Coalition is to see every child in our community throughout the region not experiencing adverse experiences. That effort can't happen alone or through one single organization, and so we felt it was really important to not duplicate anything, but to partner with existing organizations that are doing this work in the community.
Trauma is an adverse experience that affects someone profoundly and is difficult to overcome.
You know, there's intergenerational effects from trauma. There are social and economic effects from trauma. It has physical impacts. You see it play out in people's stress. You see it in their inability to hold meaningful employment or consistent employment.
The thing about trauma is sometimes trauma is instant, other times trauma doesn't show up until weeks, days, months later, and it affects everyone differently. But what's important is that trauma can affect not just a single person, but an entire community.
When you have unaddressed childhood traumas, it increases the likelihood of poverty, crime. It manifests in multiple different ways that leave people without places to live, without food to eat, and that's where we come in.
Resilient Georgia is a statewide coalition working to build resilient communities and to reduce adverse childhood experiences for kids birth all the way up to 26. We get to partner with this statewide coalition. We're one of 16 coalitions across the state to really bring resources, bring understanding, bring financial support, and bring connections to a community so that each community can decide how can we use these resources to serve people in our community in the way they need.
I serve on a truancy board called Risk Reduction alongside the school system in Oglethorpe County. So many of the families we meet with, once we really get to talking with them, 9 times out of 10, it boils down to there is some trauma in the home or lack of resources.
The role that the larger community plays in building resilience is identifying somebody that may have gone through trauma or is going through a trauma situation and coming alongside of that person and supporting them and helping them get the resources that they need.
Even though you may think it's not in your backyard, it definitely is. It's impacting your family's health and safety if another family is less strong.
I think we build resilience by having strong support systems, by being aware of what the challenges were, not running away from the challenges, but learning how to move forward.
Resilient Northeast Georgia has provided us with funding to research and begin the process of implementing Handle with Care. Handle with Care is a nationwide program that really seeks to wrap around children who have experienced a traumatic event in their home. So we are very excited and working on getting those steps in place that we would be able to bring that soon to Oconee County.
In Walton County, we can break the cycle of substance abuse with the help of community partners, educators, and our juvenile court system.
We began about 3 years ago bringing in a lot of different trainings to help ensure that across the sectors that we had individuals from law enforcement, educators, nonprofits, faith-based, that became more educated on trauma-informed care.
So this work is for everybody, and it really requires everybody, from the churches to law enforcement and the courts and our healthcare providers and our teachers. We all interact together with the children and families in our community. One child and one family may interact with a local business, and a healthcare system, and an education system, and the way we can all come together and do this work so that when someone experiences any aspect of community, it's through a trauma-informed lens and helping them build resiliency in their lives.